we're live.
Wake up call.
Chris will be pleased to see you sitting here.
Our meeting as usual.
All right, good morning, everybody.
Good morning.
I'd like to call this meeting of the Cook County Public Health and Human Services Board to order on this Tuesday, November 15th at 8:30 a.m. First thing is approval of the consent agenda. Is there anything someone would like to pull from the consent agenda to discuss further? If not, I might entertain a motion to approve the consent agenda.
Move the consent agenda.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
I'll support.
Thank you, Commissioner Svaleson. Motion and support. Any further discussion? Hearing or seeing none. All in favor?
Aye.
Opposed? Motion passes unanimously. Thank you. That moves us down to the staff report. And this morning we have Allison Plummer here to give a presentation.
Good morning.
Good morning.
Good morning.
I haven't presented for a year and things are different, so we'll see if I get this here. And then I'm going to be, the remote's not working, so I'm going to manually control two laptops. Okay. I know it's a little early in the morning to be coordinating two pieces of technology, so we'll see.
And what's that? There's like a record you're spinning too?
Is it? Yeah, feels like it. Okay, we got everything. Yeah. All right. Good morning, everyone. All right, so this is my yearly update to the board. It's our economic assistance update. Ooh, this is gonna be hard. Okay. So, just to give you an overview of the programs and services that our unit provides, the economic assistance team provides through Public Health Human Services, would be programs that we administer to help low-income county residents meet their basic needs. So these programs that we administer include assistance with childcare. We call it Childcare Assistance Program. We've got some cash assistance programs that can assist families. There's two programs. Currently, we've got the Minnesota Family Investment Program, which we call MFIP, and then the Diversionary Work Program that we refer to as DWP. And then in addition to cash assistance for families, there's also cash assistance programs for what we call single adults or married couples that don't have any dependent young children in the home. And there's a few programs for those. We have general assistance, which we call GA, housing support, or formerly known as group residential housing, and Minnesota supplemental assistance, also known as MSA. In addition to those programs, we also administer emergency assistance, SNAP, which is the big one. I think people usually that's the bigger program, the Supplemental Nutrition Assistance Program. And then we have a bucket of healthcare programs, which include medical assistance, Medicare savings programs, long-term care services, and then a reimbursement program called Healthcare Access. But there are more programs that we administer that are not listed on here, like one of them being county burial as well. So the population served by our programs include county residents and residents who are in placement out of the county. So maybe they lived here prior to being placed in a facility, whether that's supportive housing treatment or maybe like foster care. We serve all ages from birth until death. We support people with disabilities, families, and single adults or married couples without children. People who are employed and unemployed, and then kind of the basic underlying factor for the programs that we administer and the populations that we serve is really it's all driven by income eligibility. All right, so now kind of getting into how our caseloads looked for thus far into 2022. So our total caseload, so all cases through all of the different programs that we administer, has steadily increased throughout 2021 and into 2022, with the highest caseload count that we've seen since 2015. Looking at more of the specific programs, healthcare and SNAP case counts continue to increase month to month, as CCAP has remained fairly steady with an actual recent increase in applications. Our family cash cases have actually decreased with single cash cases, while, single cash cases have remained fairly steady. And the COVID-19 public health emergency continues to have an impact on our healthcare caseload. All right, so I've got some pretty charts to look at because visuals are always quite helpful. So this is a slide of our total combined case count. So we have healthcare, cash, and SNAP cases all added together on here. It does not include our child care assistance or any of our other caseloads like our foster care cases. So as you can see, we are currently in the red line, and you can see that that line is clearly above any other total combined case count from the previous 4 years. So just looking at a 5-year total representation on these charts today. We're currently at our highest previous case count right now since March of 2015 when it was at 886. So right now we are at 923. This is as of the end of October. Now looking more specifically at a breakdown of the different programs. So let's take a look at Child Care Assistance Program, or what we call CCAP. So this includes families who receive child care assistance through the family cash programs like MFIP or DWP, and those who also receive assistance through the basic sliding fee program. The program is based on household income, and it provides assistance with child care costs for working families, and it doesn't cover the cost 100%. There is a portion of that cost that the families do have to pay for out of pocket. We have had no basic sliding fee wait lists since February of 2018. So basically this means that we have enough funding, and if families were to apply, we would have funding for those requests. The case count on the chart does include active, pending, and denied cases in that month. So it kind of encompasses overall activity. We've had a fairly consistent case count since January of 2022, give or take a couple of cases here or there, about 5 to 7. And then we've had a recent increase in applications, so you see we're up to about 9 cases, again, active, pending, or denied for the month of October. All right, go on to the next one. We have family cash. So this is MFIP and DWP. And we've actually kind of seen a trend that we didn't expect. We have had a steady decline actually since the beginning of the year. The MFIP and DWP programs were at an all-time high of 38 families enrolled in October of 2016. So we are actually down to our lowest case count since 2007. And so at the end of October, we were down to 11 active cases between DWP and MFIP. And the family cash programs provide a combination food and cash benefit, and then people are also referred to work with employment services. And the employment services counselor assists families looking for work or increasing hours in their current job, maybe some extra education, things like that. It's all to lead families to self-sufficiency. All right, the big program is SNAP. So that is our food support program. It's a federal program. We have seen a steady increase through 2022, and that's the same. The red line represents 2022, and so you can see it just continues to grow as we've continued through the year. So we are seeing similar caseloads back to 2014. One of the factors why we've seen even an increase since the month of September, or plays into the increase, is the requirements or the gross income limits to qualify for the program change starting September 1st from 165% of the federal poverty guideline up to 200%. So I think it's common throughout our region. We've heard discussions that they've just seen an uptick in applications, and because more people are eligible, which is great. All right, another big program set is our healthcare programs. So we can continue to see an increase that started in January of 2020, and we are now at our highest case count since 2015. So again, we're at our all-time high, similar to SNAP, with 700. My font's too small. I gotta increase this on my side here. With 733 total cases, and what has continued on since the beginning of 2020, which is why we continue to see an increase, again, is the impact of the waivers that came about with the public health emergency. And so the continued renewal of the public health emergency, the federal declaration, the only program set that it really continues to impact heavily is the healthcare programs, so medical assistance. There's very little that we can do with negative actions on cases, so people will retain their coverage unless they move out of state, they request closure, or they pass away. Other than that, even if someone were to report that they had received they got a new job and are receiving higher income that would put them above the income limits, they still stay on medical assistance. So we're not seeing a lot of people go on and off the program because they're just staying on, which is one of the reasons why we continue to see an increase since January of 2020. There's not a lot of movement. There's not like turnover, from people being closed and whatnot. So really, it's only the people who are now looking to apply, or maybe we're on a different income, at a different income level and a different program. Maybe they're reporting changes and now they're eligible for medical assistance. So that is actually a trend that the state of Minnesota and the federal government is seeing, is just that continued increase, and now it's kind of stabilizing. All right. The next piece of data is one that this was new that I added in last year, and this is a really good picture of, besides maintaining our current caseloads, we are always dealing with new applications, and that takes a big chunk of our daily time in receiving the applications, reviewing them. We have to do interviews, we have to request verifications, there's all that processing, and not every application we get is approved. So we could go through all that work and then have someone denied. Maybe they're over income, or they didn't follow through and provide all the verifications. So there's still a lot of work that goes into just processing applications. So as I mentioned, processing includes conducting interviews, requesting those verifications, determining eligibility, and then ultimately approving or denying the benefits. So looking at the total applications that we've received, it's consistently increased since 2016. As of October 31st, 2022, we have received 208 applications, and this is all programs: healthcare, cash, emergency assistance, food support. We have received 208 applications. As of October 31st, 2021, so a year ago, we had received 176 applications. So we have already processed more thus far at this time this year than we did at this time last year. So then kind of forecasting what's going to happen in the next 2 months, in 2020 and 2021, we processed approximately 50 applications between November and December. So if we get similar numbers, we will definitely exceed 230 apps total that we saw for the previous 2 years. We are on trend to beat that number. So again, looking at our trends, kind of going back and referencing the previous graphs, we've seen an increase in applications for SNAP, similar to our increase in SNAP caseloads, active caseloads, and then decreases in our cash programs. And then our emergency assistance applications have actually kind of remained steady over the last few years. Just a note that our healthcare apps, our figures in here, does not include applications that we receive through what we call our METS program, or people know it as MNsure. That's difficult to query. We don't have those numbers. And a lot of times people are applying online where we are not actually involved in any of that processing. And most people are applying online nowadays for healthcare. We don't see a lot of paper applications. So the healthcare applications that you see on this chart are the actual applications for what we refer to as our elderly, disabled, and blind population. Any healthcare that has to go into a different program, the same program that we use to process our SNAP and cash, because those actually do require paper application, hands-on processing, so like our long-term care, Medicare savings programs, things like that. So this is just a small representation of overall healthcare apps, but the healthcare apps that require physical manual work.
Allison, can I make a comment quick on that last graph?
Yeah.
I think it's interesting in the context of what Allison shared about the waivers in place during the public health emergency for healthcare, that typically we see quite a bit of churn, especially I imagine in the METS program, as opposed to MAXIS, our legacy system, where people who are older or have a disability are determined eligible, that the waivers in place have maintained coverage throughout the last few years. So again, as people move, as they change jobs, as they experience variability in their income, their household size, or circumstances, they're frequently having to reapply. So that is something that we're watching, both as it relates to outreach with people locally and with our team for anticipated increased workload as those waivers are lifted and people again are having to reapply as their coverage terminates. So I would actually expect to see a more steep drop off in new applications, just knowing that. So this leads me to believe that we have newly eligible folks as well, or new people applying.
Absolutely. Yes, great point, Allison.
Thanks for letting me jump in.
All right. So next, we just have a little bit of a snapshot in terms of, we have our caseloads, but really kind of what does that equate to in terms of the people that we are serving in our community. So this is all as of the end of October that these figures are available. So right now, for SNAP, we have 252 people receiving SNAP in our community, and that includes adults and children. The average benefit per person on SNAP is a little over $246 a month. That's pretty substantial. We have 11 families currently receiving cash and food assistance through the Family Cash programs, MFIP and DWP, and that equates to 9 adults and 23 children, with the average benefit per person being a little over $430. We have 26 adults without children receiving cash assistance through our single cash programs like GA or MSA. For healthcare, these are some pretty big numbers. We have 1,206 people eligible for medical assistance, with 93 people receiving help with Medicare costs through a Medicare savings program. And the Medicare savings programs, people apply for, again, income eligibility wise, and this will take care and pay for their Part B premium, which significantly increased going into 2022. It's $170.10. So for people to be eligible for that program, that's for people who are on fixed income, to have $170 kind of kept in their pocket and they're not having to pay for their Medicare Part B premium is pretty substantial. Now, out of that 1,206 figure for people eligible on medical assistance, we have, again, it's kind of broken down into like what system are they in. So kind of like I'm dealing with two computers today. We have multiple programs that we work in. And so in MNsure, or what we call METS, that kind of really houses most of the population. That's a little over 1,000 people who have their eligibility determined in METS. So we're working on that caseload in that system. And out of that figure, we have 459 children eligible for medical assistance. And then vice versa in our other system, which we refer to as MAXIS, which is also where we determine SNAP, cash, any of the other programs. And that's for our population that's blind, elderly, or disabled, or we have got foster care. We have 163 people with their eligibility determined in that program, 35 of which are children. So kind of looking at the kind of scope of like what % of our population is eligible for medical assistance. And The estimated population, it's just estimated that I could find online, is about 5,684. So for the 1,206 people that are eligible for medical assistance, that equates to about 20% of our population, which is pretty substantial. Again, that could change once the waivers end. We're going to see a lot of fluctuation in those numbers. Next one is, so one of the programs that we haven't touched base on yet is our emergency assistance program. So this, Cook County provides emergency assistance for persons in jeopardy of losing something that is of basic needs, such as heat, electric, or shelter. The assistance could also be available to resolve lack of shelter or support a cost-effective move. So someone who technically maybe is homeless, going from friend to friend, family to family, if they secure housing, we can assist with security deposit first month's rent. Funding is limited with a typical allocation of about $5,000 per year for like our family subset. So there has to be a dependent children, and then about $1,000 for our single adult or married couple program. So thus far in 2022, we have spent $2,700 of our MFIP crisis funds for families and $700 of our emergency general assistance funds. So that's for single adults. This equates to 2 households receiving funds to secure stable housing. So in both of these requests, people had secured housing and they needed assistance for security deposit and or first month's rent. Although we've seen more activity with our emergency assistance funds than we have in the past few years, usually sometimes we don't spend any money at all, or we've severely underspent our $5,000 and $1,000. There was also the assistance of Rent Help MN throughout most of the year too, and I went on to their website. So if people don't apply for us, it's maybe they found funding through another source like Rent Help MN. They have a cool little dashboard tool. So up to the time that program closed and we're not accepting applications, the state had received 28 applications from Cook County. So we're here to help people, but there was also other programs going on with COVID funding. All right, so taking a look at our year in review. So for staffing, we have 4 full-time eligibility workers working in cash, food, and the medical program. So basically we work in all of the programs, and we've got 1 full-time case aide. So I mentioned earlier we kind of work in multiple programs, multiple technology area software programs. So this is kind of a breakdown on what we see with the amount of cases depending on the program. So right now we have 191 cases in our Maxa system. So this is like old school green screen, like MS-DOS, like using your keyboard, and that is where we do, again, our SNAP, cash, certain healthcare cases, foster care. We currently have 550 cases in METS/MNsure. And then we have, or which equates to, sorry, I should look at my notes, approximately 185 cases per worker is what the math breaks down to. We also have 1 worker trained in long-term care. And that is actually myself, which I will get to here shortly in some of the other kind of year in review updates, which equates to 60 cases right now that are long-term care cases. This includes people that are receiving long-term care services through waivers, or they are in a long-term care facility. So some other updates. We have a new unit name, and this was on my presentation last year, that we were moving away and updating our language and our terminology and getting away from income maintenance, because we don't maintain anyone's income. So it wasn't very fitting. So we were updating with the times and DHS lingo, and so we renamed ourselves effective January 1st of 2022. We are known as the Economic Assistance Unit, Economic Assistance Team, Economic Assistance, whatever you'd like to put after it. And we work with the economic assistance and healthcare programs. So we've had some turnover. We have not been unscathed by the Great Resignation and people looking for other progressive opportunities. So we had 2 staff leave, one at the end of 2021 and then one in 2022. So we've had 2 new staff start in the year of 2022. Christine Ordeman started in January and Andrea Cuthbert started in September. And they have both been through their SNAP training, and both have almost completed their METS training. Andrea is actually in METS training right now. So they continue to go through their training and continue to learn the programs. But that's, again, kind of a long process, step by step, for them to continue on learning. Eventually, they'll learn most of the programs. So with the turnover, it's created gaps in our program coverage. And it's kind of one of those things like you don't know it till it happens kind of thing, where we did not have adequate program depth in our long-term care and our foster care, or what we call our 4E programs. So Agni, who left in April, was our primary long-term care worker. Kathy Ann Travis had been trained in, but Kathy Ann left in December of 2021. So that left us just with Agni processing long-term care applications. And then Christine was hired in hopes that she would eventually be trained in by Agni. And then, Agni. Agni left, and it was like, oh my gosh, we have no one that knows long-term care. Not even myself. That was a program, a subset of the healthcare programs that no one else, not even myself, had ever learned. And same with our foster care adoption assistance cases. So I actually took on the long-term care training. In total, it's about 40 hours of training. It's pretty long. And we also did the foster care 4E training with 2 of my other staff. And so right now I'm the sole worker in long-term care, and I will be for some time. So what that has made us realize is that with short staff, it's really hard to train everyone in all of the programs, but it's really dire that we do, because you never know what's going to happen, whether someone's out sick or someone resigns, and that's going to put a gap in being able to process programs, even just to have other people familiar with the knowledge of how the programs work, that if someone were to call and ask, like we'd have to dig and reach out to other counties. So we have really put a focus on cross-training. With one of my other staff, seasoned financial workers, is set to take long-term care training here after the new year. And we'll continue to do cross-training in multiple programs. And I think ultimately, as much as that sounds to be daunting and a lot, it's going to lend to better service and having everyone familiar with how the programs work versus kind of being siloed. So a good thing that came out of it. And I'm actually really happy that I learned long-term care. It's a really interesting, it's not a program, but part of what goes into determining medical assistance. So I've actually really enjoyed it. And I'm a kind of like part-time eligibility worker again. I haven't processed things in quite some time. So then one of the other things that we have just actually finished and are looking to wrap up is our SNAP management evaluation review. So we went through this management evaluation process, and this is it's required of the federal government for the SNAP program. So then DHS is required to basically go through this audit. And we go through it every 3 years. And DHS reviews how we're doing. It's an ongoing performance outcome, and it measures or recognizes, where are our strengths or where are there areas that we need to improve upon. And so there was an area identified this year in our management evaluation review in regards to program access. So this is, when people call and ask, how do I apply? We're supposed to give specific pieces of information. We're supposed to have certain bulletins in our lobby and so forth. So there were a couple of things identified, and so we will have a corrective action plan for that, which really just goes into, they're going to update on the website and then some just internal training, which is great because, again, with staff turnover, it's important to have these refreshers and these trainings so everyone is familiar with what do we have to tell people when we answer the phone and so forth. And so that has been submitted, but we're still waiting for the final outcome and approval by DHS. I won't spend too much on this slide, but one of the performance goals that is continued to be observed and checked by DHS is how we process what we call expedited SNAP applications. And these are individuals that basically meet a requirement to have their interview done the same day and then their benefits determined and approved really within 24 hours is the goal. So DHS actually mainly looks at our expedited 5 business day processing. Again, we strive for approving everything within 24 hours. We have up to 7 calendar business days, but they look at the 5 business days to see, are we meeting the threshold of, basically it's 96% of our applications that meet expedited criteria are processed within those 5 business days. Smaller county, smaller numbers. So as you can see, we're at 19 of our 20 applications have been processed within the 5 business days, but we're at 95%. So one application can make a big difference in our numbers, but 19 out of 20, I would say that's pretty darn good. So looking ahead, ironically enough, this was the same thing that I had on last year because we've been waiting for things to resume to normal, primarily when it comes to healthcare. But I said this last year. And so the public health emergency, as it continues to be renewed at the federal level, keeps pushing out our return to normal processing standards. So as Allison mentioned earlier, we're still kind of hands are tied on a lot of respect to healthcare. So we just kind of have to keep waiting. And we're supposed to receive a 60-day notice, which 60-day notice prior to the expiration of the current declaration for states to know if they plan on renewing or not renewing the declaration. So that is due to end here in January. So by the end of this week, we should have a good idea. If we don't hear anything, it's probably going to be renewed. So this keeps pushing out our timeline of when healthcare processing will return to normal. If they do not extend it, we would be looking at next spring. Otherwise, if it keeps getting pushed out, we're looking into halfway through, if not the entirety of 2023. Again, will not be, hands will be tied on working on healthcare cases. So again, this has had a pretty large impact on our healthcare caseload. Not a lot of turnover, so that's why it has remained fairly steady with still some increases in applications. We will continue to cross-train, as I mentioned before, cross-training staff in all program areas as the training becomes available. And then we're also kind of looking at updating and shifting around some office spaces. So as we have added in the agency staff, we have also been quite short on working space. And so we've been coming up with ideas on how to make the most use of our current space. And we've got some old, clunky, outdated furniture in a couple of our shared office spaces within income maintenance. Oh, how dare I? Economic assistance in our shared office spaces, which are some of the largest shared office spaces that we still have. So we're looking at potentially updating the furniture in one of the shared office spaces and making it going from a 2-desk area to a 3 shared office space. Ooh, that was a commingled word choice. 3 desks, I got it, okay. And then moving our case aide, our economic assistance case aide, Sarah, into that shared office space. Right now she sits primarily at the front desk, but she does a lot of processing and she's our healthcare access coordinator. So she works really closely with our unit as well as covering the front desk. But as we, again, add staff and looking to make room for them, it makes sense to incorporate her back into the economic assistance unit and make a desk available in the front desk area. So that's been kind of in the talks and the plans for a little bit, so something we're still looking at. Other than that, before I wrap up, I just want to give a big shout out to my economic assistance team, my financial workers, and our case aide, and everyone else upstairs that assists with what we do. There are some office support staff like Isabella and Melissa Wickwire. Just everyone, just a big kudos and a big shout out to the work that they do day in and day out. This is not an easy job. Most of the time I would say it's fun, at least on my behalf. I love what I do. And I want to recognize the accomplishments of my team over the last several years for how hard it has been to adjust to waivers and constant changes, which there always are in legislative policy and things like that coming from the state and the federal government, but even more so having to keep up with all of those changes that have happened over the last few years, and again, still working through a lot of those different policies that are in place while we're still under the federal declaration. So a big shout out and a big acknowledgement to the economic assistance team for all their hard work. And that is it. But I want you to take note of our new email address as well. So our email address before used to be IM, which stood for income maintenance, and most of our clients were like, oh, I have no idea what that is, but IM is pretty easy to remember. So with our team name update, we also updated our intake email. This is our general contact email that goes to our team. It is now economic.assistance@co. Thank you all.
Thank you, Allison. I'd also like to extend the kudos to you specifically for your work navigating all the churn and cross-training and just the continued increase in workload. So thank you for leading such a great team, too.
Thank you. Thank you.
Any questions for Allison? Commissioner Sullivan?
Surely. Allison, I have a question related to the increase in healthcare and SNAP cases. I know that occurred as a result of change in eligibility. When you are analyzing that increased number, do you also look at the age of the people that are applying? Do you collect any data to see if there are other changes that are occurring?
Good question. That's not something that I've included in my queries. We have a database that allows us to query some of the information on cases, and I don't recall if, say, date of birth would be one of them. That is something definitely I could do, but I'm just trying to think offhand. I can't think of any trends right now related to age. We've had, really consistency across all populations. I would say family, single adults, younger, older, fixed income, no fixed income, no job, maybe they have a job. So it's still, everyone's still impacted kind of throughout all levels, not dependent on age. So I can't think of any trends right now that we would have seen. And again, unfortunately, I didn't query that.
Okay, well, I was just curious.
That's a good thought. In terms of the healthcare applications, we're still seeing a steady trend in METs, so MNsure, people applying in MNsure, which again is a very specific population. They're under the age of 65. They're not blind. They're not disabled. So we're still seeing that increase. And then in terms of healthcare applications that we process in Maxis, so those over age 65, blind, disabled, that would include like long-term care. I didn't work in long-term care before, so I'm not sure what the processing looked like, but I don't see any necessarily increase in those. Oh, but I should look at the chart. Let's see here. Total applications. So, no, it's actually been a decrease. So, let me look at I'll bring the chart up here. So, on the total applications chart, we have the column 2022. So, if you look at the healthcare, the green line, year to date, we've only seen 29 applications. This again would be in our Maxis system for elderly, blind, disabled, foster care. And entirety of 2021, we were at 53. So we're still less than half, if my math serves me right. We're about half, with only 2 months left to go. So actually, I would say we've seen a decline. Right now, I don't have any pending new long-term care applications. I've got a couple of people, well, one active one that's on medical assistance looking to determine eligibility for a waiver. And that's been, so it's been pretty quiet right now for the last several weeks on long-term care. And foster care has been pretty quiet too. So like out-of-home placements, people applying for foster care 4E payments has been pretty quiet. So yeah, so I guess I can lend insight to at least maybe the healthcare portion for the elderly, blind, and disabled.
All right, thank you so much.
Good question.
Any other questions for Commissioner Svaleson?
You know, you talked about end of this next week, hearing whether they're going to go back to the previous. If you don't hear that they are, just from the staffing and the workload perspective and things, just, I think the staff and overall, you just got to step back and say, this is the new normal. Right? And because, and from a staffing perspective, as somebody that's worked in those where you always, when you see something when the pandemic started and they declared the emergency, everybody said, okay, here we go, you know, and you step up and you do that. And you're thinking, well, we got to do this because we got this going on. And so you do the extra work. And then as it proceeds into the next year, you start saying, okay, and now that it's gone on for 2 years, it's kind of hard to say, well, you know, go back to normal. Well, this has become normal now.
Right.
And the question is it sustainable? Right?
Mm-hmm.
Working at that with the additional caseloads and that type of thing, with the current staffing and the things that you have, right? So it's more on the philosophy of how you look at your workload and things. But if you keep telling people that it's going to get better, it's going to get better, when you don't control it,
Yeah.
you see what I mean?
Yeah.
And so those are the kind of things I've had to go through a couple of times in my life that you just finally have, after it goes on so long, the folks are looking at you and saying, really? Come on. I mean, isn't this the normal now?
Mm-hmm. Mm-hmm.
And then you have, once you do that, then at least everybody recognizes you're looking at it with clear eyes and with what's the real workload and how are we able to adapt, or do we need to change something? That's the only reason I bring it up to you, because otherwise you've had some changeover in your staff, and 2 out of a group of 4, that's huge.
It's
as you've
huge.
seen. So you don't want that to persist, and you want the folks there to see that you're looking at least clear-eyed about what's in front of you and how you're going to deal with it. So that's all I encourage you. At the end of next week, if you don't get a hint that there's something is going back to the previous, step back and do that evaluation so that, and
Yeah.
engage the team so that everybody gets, you know, a say in what going forward looks
Yeah.
like.
And like Allison mentioned earlier too, is like, I think right now we're actually like, whew, okay, like we're in the better stage because like healthcare, with the waivers that have been in place, people don't have to go through their annual renewals. We're
Oh, I
manually
see.
processing those so
Okay.
everyone continues coverage. And that's
Gotcha.
something that I've been doing and taking on that workload of processing those, and that ensures again that ongoing coverage because no one can be closed unless for certain reasons.
Right.
So that part of our workload hasn't been occurring for the last 3
Okay.
years
Well, that's
of receiving
helpful.
renewals and updating. So right now we're like, I think we're in a sustained
Yeah,
like
I
calm
get you.
before the storm.
Yep, I
And
get it.
so as Allison mentioned, you know, it's just kind of that eager anticipation of like, will it, won't it?
Yeah.
When
Oh,
will
I'm
that
with you.
federal declaration end? Because DHS has created a timeline and it keeps getting pushed out
Yeah.
of this return to normal, which with what, 500 and some cases, 1,200 people being on medical assistance.
Yep.
After 3 years, the information that we have for people is not the same as it was.
Right.
And all of that is going to have to be manually updated and processed. And so we're
So
kind
I
of
guess either way, you have to look at it.
we're
depending on what they
relishing
say.
in the calm right now, knowing that it's eventually going to be very, very chaotic for us, but we have been working through, and I've been thinking of ideas of the social outreach, the social media outreach that we can do when we do hear that,
Yep.
like,
Good.
we're not going to renew it, get ready, of to give people that kind of heads up of like, you're not going to like it. You may not be happy with this, but these
reality.
big changes are coming,
Yeah.
and so we are preparing for that. But it's also hard to prepare when I said this a year ago, thinking
Right.
that in April of 2022 it was going to be back to normal, and it's still getting pushed out. So yes, kind of the new norm. I'm guessing continued increases with SNAP with caseloads, case counts. We'll see how things go, but definitely with healthcare, it's kind of its own unknown
Right.
right now.
Well, and I congratulate you for the cross-training. You've done it out of necessity because, but you've had a hard lesson with small groups. It's just imperative. You really want people to be able to focus and become experts in their area, but it's really more important to have generalists in all of the areas.
Right.
And then as those unique conditions come up, you got 4 people to think about what you should do versus, and it just,
Right.
that's the nature of working in small teams, but congratulations on what you've achieved with it, and really appreciate all the hard work and focus on it.
Thank you.
Any other questions? All right. Thank you, Allison.
Thank you very much.
As always, a very insightful presentation, lots of details, at times overwhelming, but you do a really good job explaining everything, so thank you.
Thanks. Thank you. Yeah, I'm here anytime you have questions. Feel free to email, reach out to me. All right. Thank you.
And that brings us down to our director's report.
Start
Allison.
off with just echoing the gratitude for Allison and all she's done to maintain continuity of service to older adults, persons with disabilities seeking long-term care services. When our second member of the team who knew long-term care services resigned, Allison jumped right up and said, I'll learn it, I'll do it. And that wouldn't be the case in many other counties in our state, where a supervisor would take on one program fully and with the same enthusiasm as Allison. So very grateful for your service to Cook County and to our team, Allison, for all you've done to maintain consistency and a really positive outlook. So thank you so much.
Thank you.
Moving into other staff updates. We are thrilled to be welcoming Nancie Deming to our team as our Childcare Coordinator and Licenser. She's starting today. She, as you all know from hearing Nancie share information at our special meeting on childcare, is deeply engaged in this work, very knowledgeable, has many relationships throughout the community with providers and others doing this work through her role on the Sawtooth Mountain Clinic Early Childhood Hub Grant and as a member of the Rural Child Care Innovation Program team. What else do I want to say about Nancie? Okay, so she will be working with the Minnesota Department of Human Services Licensing Division, both for mentoring and consultation, and will participate in the Licensor Foundations training in early February until she's able to complete this training. This is the next time that it's offered by the state. She'll not be able to do any official activities such as inspections. If those activities are necessary during this time frame, we will be looking for support from another county in this work or from the state. And then again, she will be working both with Grace Bouchard, Grace Gernager, others throughout the community who have been involved in this work to develop that child care coordinator aspect of her job. We'll plan to introduce Nancie and hopefully 1 or 2 more new hires at our board meeting in December. We had interviews over the last few weeks for the behavioral health supervisor position. We had several very strong candidates for that position, and we'll hope to have a recommendation for hire in the coming weeks. We are continuing to recruit for our family services case manager position. This is one that we have had to repost multiple times. And then we have several recently vacated positions that are in the process of being posted to backfill, those being our social services case aide, children's mental health case manager, mental health skills worker, our adult services social worker position as well. So we are very sorry to be seeing both Olivia and Cooper leave the department. Both had considerable length of service with the department, and it's a big loss for us. We are paying attention to what is happening with turnover in our department, both locally and what's happening at a state level. So I wanted to share a few comments on that. In my report today, we have had 11 positions turnover this year, which is a new high for us, a significant increase over last year, which was our then high at 8 positions. Previous to that, the trend was around 3 or 4. We're beginning to see the impact of turnover and vacant positions on our performance requirements with the state. You heard Allison share this morning about our corrective action for SNAP. We have a small team. We're limited in our ability to cross-train. We have highly specialized positions like licensor that require very specific training. In many cases, our supervisors are stepping up to backfill these positions, but in some cases, they simply can't because they haven't had the foundational training. So we are seeing corrective action across several areas in addition to SNAP, including ICWA and MIPFA, which is the Indian Child Welfare Act, Minnesota Family Preservation Act, and our Rule 13 licensing review with the state. So we're in various stages of meeting with the state, with local partners to understand where those deficiencies are, how to correct them, ensure that staff are cross-trained. But turnover and vacant positions cannot be ignored as a significant factor in our performance. Another reason why we're really grateful to have Nancie coming into this role with her strong background in childcare. She still has to go through that foundational training, but has a lot of other assets and skills to offer in that role. Cook County's not alone in seeing the impact on our performance standards. We recently received a report from the Department of Human Services Performance Management Team that in child support, in one of the measures that child support is measured on, they saw an unprecedented statewide decline in performance. Had they pursued performance improvement plans for that measure, 1/3 of the counties would be impacted and would be completing performance improvement reviews. 2/3 of the counties had a negative year-over-year average threshold. So DHS is acknowledging that there are major systemic issues at play with county performance. Interestingly, Cook County, through our partnership with Carleton County, was one of the few counties that did not have a significant drop-off. But I just bring that up to provide some additional statewide context for what we're seeing here locally. We're not alone. I attended a presentation earlier this year, it was in August, from the Department of Human Services to MACSA, which is the State Association of Social Services Administrators, on some of DHS's workforce legislative strategies for the session. What was reported is that job vacancies in Minnesota are at record highs across all sectors. Probably not a surprise to any of you. However, healthcare and social assistance sectors are the most severe. 52,000 vacancies statewide. This was in August of this year. That represents over 1/4 of all vacancies across the state are in the healthcare and social services sectors. This high rate of vacancy statewide means that we are competing with many other organizations and entities, as well as the expansion of fully remote work really expands options for people within the county, and it means that we're now competing with large health systems for retaining and attracting staff. Bring this up to you all in the context of our classification study underway, our compensation study underway, that this is a particular effect that we're seeing here in Health and Human Services, just with the overall demand for staff. and our need to remain competitive to continue to attract and retain quality staff. When we lose staff, it affects our performance, and we need everyone on staff as these positions remain unfilled, or as we see an increase in the number of positions turning over within the department. It has a significant impact on our team, on our ability to provide services, and has ripple effects through the organization. It's impacting our supervisors in particular. This nonstop turnover is very discouraging for them, and it impacts their work, their ability to perform their supervisory duties when they're having to fill in, backfilling multiple positions at a time, the amount of time it takes to really adequately train and onboard staff. When we don't have a period of time for cross-training, that falls fully onto the supervisor to do that work. And they're having to cover intake, after-hour shifts, and other responsibilities as these positions turn over. We do expect this climate to continue, so again, I bring this up just to let you know that we are paying attention, that we're being impacted by the high demand for staff in these jobs, and that we are competing with very well-resourced organizations like health plans for our staff. And just again want to acknowledge the supervisory staff, Allison, as well as Grace Bouchard, Martina, Lori Erickson, Grace Renager, for all that they're doing to maintain stability, stay focused on our mission, our role in serving the community, but that is not without significant impact on each of them. I do want to say on the other side of this is having additional staff in our public health team has really made all the difference, and want to recognize and thank this board for supporting the addition of another public health educator. That has really allowed us to manage workload stress within that team in a highly uncertain time of pandemic recovery and response. And I'll move into some of my updates from our public health team at this point. In our COVID-19 response, our community level of COVID moved from high to medium last week, representing both fewer cases and slightly less stress on the regional hospital system. We just wrapped up a series of evening and weekend bivalent booster events on the West End in Lutsen and Tofte, and weekend events in Grand Marais at the Community Center. These events were a collaboration with Minnesota Department of Health, and we're still waiting on an exact number of how many were vaccinated. Our estimate is that those 4 events served around 200 people. We're working with Sawtooth Mountain Clinic to offer an event along the Gunflint Trail sometime in the coming weeks. Details will be finalized later this week. Currently, Cook County again has the highest up-to-date COVID-19 vaccination rate in the state of Minnesota, with 28.6 of those who live in the county up to date. This is a huge accomplishment and speaks to the hard work of our clinic and our public health staff, dedication of our volunteers through Minnesota Responds, and the willingness of our community members to take steps to get vaccinated. We're still working on how to raise vaccination rates with a particular focus on youth. Our youth rate is less than 10% up to date. We're working to emphasize that the bivalent vaccine is unique and not just another booster, but it's better matched to the Omicron variant, which represents the majority of cases of COVID-19. This winter, COVID-19, influenza, and RSV are all expected to cause high levels of stress on our hospital system. Staying up to date on both flu vaccine and COVID vaccine can, again, help reduce stress on our healthcare system, reduce the number of days that people need to miss work or school while ill. Staying home when sick, getting tested, if you have any symptoms, and following public health recommendations after an exposure continue to be the most helpful ways to keep everyone healthy and reduce the burden on the community. In other areas of our public health team, we are continuing to roll out the Healthy Housing Program. You heard Andrea present on this last month. Since that time, she's completed 6 assessments in Cook County. Our target populations in terms of outreach and targeting resources to help mitigate safety concerns are among families with young children and older adults. This is consistent with our community health assessment, and in priority health areas around support for families with young children and supporting adults aging in place. Some of the needs for older adults related to safety that are coming through these assessments include things like railings, fall hazards, both inside and outside the home. We're having a lot of referrals internally from our adult and home and community-based services team, which is great because that really allows us to maximize funding for mitigation, and that in some cases we're able to access other funding streams to help address some of the safety concerns in individuals' homes, and that leaves us with more resources to support other households. The other big thing that's happening both at a local, state, and national level is around ICWA. Supreme Court arguments started last week. ICWA is a federal law that explains how tribes must be involved in matters of child welfare. There's a lot of uncertainty in terms of the timeline with what's happening at a federal level, and efforts are underway across the state to codify ICWA in state law. We do have the Minnesota Indian Family Preservation Act, but that is built on ICWA as a foundation. Resources for compliance are a factor across the board, both with states, with tribes, with counties. So what my involvement has been to date is that I met yesterday with policy leads through AMC and MAXA to learn about efforts underway, to work collaboratively with tribal leaders to respond and understand the potential impact on what might happen at a federal level. I'm involved with the Human Services Leadership Forum, which includes Department of Human Services, tribal and county human services leaders, and we've been invited to join members of the Minnesota Indian Affairs Council this week to learn about the U.S. Supreme Court hearing on the Indian Child Welfare Act. This meeting is being jointly hosted by the Indian Affairs Council, Department of Human Services, and the Indian Child Welfare Advisory Council. So I hope to have more to share on what's happening with that, but the efforts, as I understand, are to look at what's happening, what's working well, the engagement that's already happening across governments to improve outcomes and preserve families. That's all I have for updates this morning. Happy to respond to any questions.
Thank you, Allison. Any questions for Allison? Commissioner Svaleson?
Not a question, but I do want to acknowledge, I recognize you've taken great pride in being able to maintain your metrics. You've done a phenomenal job, with the staff you've had, and I've always tried to compliment you on your audits and things because you guys have just done so doggone well. So I know it's when you fall short on anything, it really hits home for you because I recognize how internally you've got that, and you try to set everything to do that. Reality is reality, and I know that's a hard pill to swallow, but it's a fact. You have to do what you have to do with your staff to make sure you're focused on what the right things are for the people. And metrics, if you let them, normally if metrics are perfect, which they never are, but if they were, they would drive you to do what's right for your clients, right, and for the people of the county. You'll have to decide whether that's true as you go forth, and then have conversations with the state on why you've made the decisions you've made based on your staffing levels and everything else. So communications is the biggest part. It can be an opportunity to actually realign metrics to make sure that they're driving what you really want as results. Because you never want to try to manage numbers. You want to do what's right for your, So keep that perspective as you're dealing with them and going through. And I know I have great confidence that you're keeping a close touch with your supervisors and your staff on, where they're at and what they're capable of doing versus what, what's required to be done, along the way. You just have to do the best you can. On ICWA, we all share that concern. We had a discussion at our last week's meeting of this. And it's unfortunate, but we'll have to see what the state can do. And we all know why it's there. We all know the importance of it. And we hope it's not the results of whatever happens with the Supreme Court doesn't erode any of those things for our community members that, because I think we've worked very, very well with our tribal counterparts to ensure that this has been carried out effectively throughout that, and we get the best results for all parties involved. So I think it's just one, keep a close eye on it and go forward with it. That's all you can do. Yeah. But thank you for what you're doing, and it's tough. Anytime you're dealing with staff turnover, it's tough. And in your field, the workload doesn't lessen, so you have to try to keep that positive outlook so that everybody keeps pulling as best they can.
Thank you for your comments, Commissioner.
Any other questions or comments? I just want to thank you for your work and role in helping your supervisors, supporting your supervisors in the hardship that they're experiencing too. And I know it affects you, and I'm sure those metrics, like Commissioner Svaleson is saying, kind of get to you too. So just know that you have our support, and I hope we can do everything we can to support you. That moves us on to item 5, items for board action. There's nothing this month. And then down to item 6, committee reports. The first one is the Active Living Steering Committee, Commissioner Svaleson.
Yeah, we've gotten updates again on our Safe Routes to School and the activities that going in to get the signage put in place, the crosswalks put in place, this type of thing. Had a considerable discussion about the new trail going in down at Great Expectations right alongside there. They've changed where the student crosswalk is for drop-offs. That's now at the corner. And, with anything, a change, if not managed properly, can create issues. So they were having a lot of discussion with the Sheriff's Department and with the Highway Department and looking at signage, and even to the point of having discussions with the people that work over at the Arrowhead, cooperative building across the street on where they park, because with it being right there, people now trying to turn and do these things are being delayed. And so a lot of good discussion, but that was the part I wanted you to know, is that all the right parties, it appeared, were involved, and we're having good discussion to ensure foremost that we had a safe crosswalk condition set up for the kids to get, back and forth and do what they needed to do. So that was a piece of it. And then the exciting thing, you may think I'm odd for saying it, but it's true. We began the review of the Active Living Steering Committee Mission, Vision, and Values document, and looking at that for updates and these types of things. So that's always something that is kind of an arduous task to go through, but it's so important if you want to have longevity of any group like this, is to have those and then to refresh them periodically. So we did start that last meeting. We'll be carrying it on again and this month as we go through it. That's it.
Thank you. Moving on to AOA, I don't think I have anything to report, and same with AHA. And that'll bring us down to Arrowhead Regional Corrections. Commissioner Hawkins.
Well, at our last meeting, they are looking at installing solar panels. Initially, there were some proposals and some federal funding available that may make this possible, not right away, but in the future. And they were excited because their utility bill is about $120,000 a year, and it might be a way to reduce that amount. So that's what they're working on. They've increased their domestic abuse programming at NERC. They've had a lot of requests for that from the residents there, so they are expanding that programming. And another thing that came up was there's some behavioral mental health issues with the residents that are there, and they seem to I just wrote down, the fentanyl is causing a lot of these issues. So it's a big problem in our area. That's all I have to report from the last meeting. I have another one on Friday.
Thank you. Brings us down to the Community Health Board, and I guess I would just report that we had our Personnel Committee meeting and did the director's annual review, and Community Health Board's in a very healthy place financially. And that's not always, there are times where it's kind of touch and go, and so it was a good feeling to see and hear that. And gives me a lot more confidence, even though I had plenty for our director there, but just how the team is doing and managing. I think, I don't remember if I told the group that the ship, I guess I don't know the title, the regional ship coordinator, Brian, is moving on to the state. But he will still be interacting with whoever we get as our regional, who then, oversees our county coordinator. So that's both sad, but also seeing him move up to the state is great to see because he's good stuff there. So gives more confidence in our state organization. Moving on to the local mental health advisory council, Rana.
Well, I actually grabbed the wrong thing when I left the house this morning, so I do not have my notes, and I can't really remember I know we had a good meeting, and we talked about a lot of things. The only thing I really remember is that we need more money for the yoga program that Carly Puck is doing with the schools, and she needs funding sources for that, so. Well, we didn't come up with any ideas, but that was listed probably as one of the last things we talked about. But do you have any other?
I would just add that our public health staff led the group in assessment. It's called the Copewell Assessment, designed by the Minnesota Department of Health, and is one of our required competencies for public health preparedness and recovery is to look at community health, mental health resilience, and people's perceptions on what factors increase resilience in a community and help communities be better prepared for future disasters. So we had a really great conversation with our advisory council members about things like belonging and people's ability to reach out to neighbors for help. And I believe a similar assessment was conducted at the Emergency Preparedness Committee meeting, slightly different audience and group of stakeholders, but that was a very rich discussion, and thank our staff for bringing that to the advisory council to get their input.
Yeah, that's right. We did the long survey that Grace did, yeah.
Yeah, it was kind of fun.
Yeah.
It was collaborative survey, which is interesting to work through. Everyone's got their own opinions, and it was interesting just kind of hearing different perspectives, like Allison said, just about if someone's a newer resident or a long-time resident, or just what circles they're in really affects how they belong and what kind of community they have. But by and large, I'd say our community is outstanding and very exceptional. So I was doing my darndest to try to share that perspective too. That moves us on to restorative justice. Commissioner Hawkins.
So, meeting tomorrow, so I'll get the total update, but there was a training down in Schroeder area over the weekend, and I was not able to attend. I had to be out of town, so I think things are going along. The truancy coordinator position is, I think, open again. I haven't heard that it's been filled yet, or if they were extended the application. And so, yeah, I'm on that truancy subcommittee, but I haven't received an update, so I'll know more tomorrow.
Thank you. Council on Aging, Commissioner Sullivan.
All right, well, the Council on Aging met yesterday, and of course, the big news is about the Grand Marais First and Second Thrift Store. They are forming their own 501c3, breaking away from the Cook County Council on Aging, and are still searching for a space. There is a strong possibility that the Birch Bark Gallery may be their new home. So they're in the process of negotiations. They're looking into that space. They need 2,400 square feet for all their items and activities, and that is 2,500 square feet. So anyway, they're looking at that and talking about if they were to develop a contract, what would utilities look like, and getting all those pieces into place. So anyway, in the discussion phase, and I'm sure by next month I'll have some firm news, but you'll probably have heard it already out in the community. But they are in the process of not accepting any further donations. I want to make sure the community is aware of that, and that they're trying to just really have a number of sales between now and December 31st so they can deplete all of what they have on hand and not have a need for such a huge amount of storage during this interim period. But they're making really good progress. It's an exciting time, a time to think a little differently, and they'll have lots of new journeys in front of them. And we're just hoping that it goes really, really well. In terms of the Council on Aging, just lots of activities, just a tremendous number of people being served. I was looking at their sign-in sheets yesterday. They had 1,200 people sign in during the month of October for activities there. And so it really is serving a great need in our community. So we'll keep you informed about first and second, and just a reminder to the community, please, no more donations at this time.
Thank you. That moves us down to emergency preparedness.
All right, well, we did take the same survey with Grace that you referred to with the Mental Health Advisory Group, and like you say, a totally different group participating in that. And then we also talked about, for the future in emergency preparedness, some things we hadn't looked at in a long time, like training opportunities. And so we're looking to the future, kind of post-pandemic, endemic, and getting back into regular schedules of training for our community. And then I just want to compliment Grace with her discussion about the cooperation between the Minnesota Department of Health and our community here in providing the bivalent booster events. I happened to go to the one that was on the first Sunday. When they tried it out, we had 63 people attend that first session, and I timed it. It only took me 17 minutes in and out. So it was very efficient and very well done. And up the Gunflint Trail, I know there'll be an announcement within the next week about events up there. They're looking at either something at the Mid-Trail Fire Hall or potentially at Gunflint Lodge, and possibly both. So we'll definitely get that word out to the community as soon as it's finalized. Anything else you want to add,
I
Commissioner
was not
Svaleson?
able to attend.
That's right.
I've lost that notification, and so I
That's
don't know
right.
when the meetings are.
All right. We will make sure you get that. All right.
Thank you.
Much.
That moves us down to the Healthcare Planning Committee. Commissioner Storlie.
We did not meet, but I will fill a little bit in on ARDC, Arrowhead Regional Development. There's two entities to it, so I'm on the commissioner board, and then there's a group called the commission. And that's widely representative by city, county, different representatives from all over northeastern Minnesota. And at that meeting, Andy Hubley introduced a resolution that was passed by all of us for more money for childcare from ARDC. We're not sure how all that can be applied for, but as we move on within the county, I'll have some ideas from here, and we'll take it down to the next commission meeting, which meets 4 times a year, so it'll be into next year before they meet again. But that's good news, that there will be something there for us. And did you see the ad? This is the first time that ARDC has had an ad in our paper
Mhm, I saw
about a
that.
commissioner,
Mhm.
joining the commission, that is, yeah. You know, there's just people that go in and out for whatever reason, representative, their township or city or whatever, and then they move on, and now we're having some gaps. Also, we have gaps too. So I thought that was interesting that we had that in the paper. I'm going down Thursday for the next commissioner meeting. And then moving on to NACO, I will report there that this last time, when we meet now, we're doing Teams rather than Zoom, just a little bit easier for everybody because we're nationwide, and a lot of the folks who were on our last call, representative of the East Coast, and they're quite concerned about a new drug that's coming into southern United States from Australia. There's a leaf that Australians have chewed on for years, and we probably all know that there are some different areas of people who've done that for centuries. However, the leaf is now being compounded into a pill, and it's being exported to southern United States. Mostly I'm hearing from folks in Louisiana, Alabama, Georgia, and the Carolinas that this is becoming a big concern besides opioids and fentanyl and all of that. So right now it's just out there, but I was trying to remember the name of it. There's a lot of leaves they chew on in Australia.
It's probably kratom.
Kind of like that with
Yeah.
a C.
It's-
Yeah, have you heard of that?
Oh, yeah, yeah. I actually take it.
Oh,
It's a legal supplement, herbal supplement, and it comes from Southeast Asia, and and I guess it's more of like a labor herb, and so
Oh,
laborers will chew on it,
Oh.
and it can have significant effects on the liver, and so when you take it in that concentrate, it can just destroy your liver,
Yeah.
but. A lot of people are using it as an alternative to painkillers and opiates. And so there's some interesting documentaries out there about kind of that, what's going on, because like you said, it is a huge concern when you get in that concentrations. And the United States almost outlawed it because of those risks, but there was such a movement of protest of people who take it instead of opiates that they kind of backed off, the United States backed off of that for the time being. But because of just what you said, I think they'll be revisiting again. So it's very, very interesting. But yeah, and from my experience, I think there's also concerns about addiction,
right.
and I'm not as familiar with that. And I guess I would liken it to coffee, but I think in those higher concentrations, it can be quite dangerous, so.
Right, that's what they're worried about,
Yeah,
yeah.
yeah.
And I don't know if you've all been probably keeping up with the end of the politics. I know we're all tired of it, but I understand that our governor wants to introduce a marijuana to Minnesota, and that's kind of the first on his agenda. And so, Dave, I don't know, do you remember when we went to AMC and we had two different presentations, one from the state of Washington and one from the state of Colorado? And just, it was interesting how in those states, there were certain counties that could withdraw from that. And I don't know where that's all going now.
Yeah.
You know, with those states and all, but I think it may be something that we might want to keep our ears open to how the governor's going to lead on that.
Yeah. And that cannabis committee in AMC, there's been more talk about that, and really, the platform for AMC hasn't changed around it. And so there's a fair amount of anxiety, kind of, okay, what's going on here? Because as we know, there was no discussion before, the edibles, what was thrown into there. And it seems like that was kind of a political move. I don't know, but the bill is written and passed the House. So then the Senate wouldn't take it up this last go around. And so now the tables are different. And I'm really curious how that will be navigated, just because both the House and the Senate, I think, are are looking to push it through as well. And I'm curious if it'll happen before the next session, if there's going to be a special session, if blah, blah, blah. You know, there's all kinds of politics there. It's very interesting. So I'll let you know, though, if I hear anything from the Cannabis Committee. But so far, no.
That's my report.
Thank you. That's a good one. I think, what is the next one? The Northeast Office of Training. And very, very similar to ARDC, that has the elected officials board and then that kind of the community board. And so we had a training because there has been some changeover, and it was helpful for the director and the organization to get everybody on the same page about what roles are required for those two groups and then the organization. And that was done by, I forget the guy's name, last name Painter. It wasn't Richard Painter. It was, kind of looked like him though. But he was from DC. But it was a really good presentation, and it had some good questions from members of the board, not the local elected officials board. But and I had not met any of them, and so it was just virtual. But you know, we're looking at ways we can touch base on a more regular basis, because that was the first time in my 4 years that I've ever had any interaction with that board. You know, always just with the local elected officials, and that's yeah, it's important to have that line of communication going back and forth. But again, different roles, different responsibilities. So, and then moving on to the North Shore Collaborative, we did meet, and we passed a whole slew of grants. There was way more requests than we had budgeted for, and I think Rana alluded to that not all requests were fully funded, but in a first again in my 4 years on this, we actually tapped into the reserves, so to speak, and you know, that makes me uncomfortable, as you all know, but there's really no need for those reserves anymore. The organization has changed enough. They used to have 7 staff members or something like that back in the day, and now it's down to 1 part-time in Lake County. So we took a pretty good look at that, and got some advice from the Lake County auditor, and tapped into those a little bit to try to help, because we want that money out in the communities, and so thought it was better to do that. But yeah, it was a good meeting. Moving on to our Public Health Human Services Advisory Council, and Pat's not here today. I'm trying to rack my brain about, we didn't meet because of I'm trying to remember what.
November 2nd.
Election.
Feels like a lifetime ago.
Yeah.
Somehow, but I can pull up my notes.
That's probably better than my memory.
We had quite a bit of discussion about AEOA fuel assistance and the impact on funds being delayed at a federal level to people locally and regionally receiving those ongoing fuel assistance funds. We talked a bit about our efforts as an agency to allocate some of the funds that we have available, both through state grants for housing crisis, and then some donated funds that we have to just come up with some criteria for prioritizing needs and supporting people who have an emergent fuel crisis while they wait for the AEOA funds to come through. We talked a bit about the HRSA grant as well for substance use disorder work in Grand Portage and Cook County. We had our first meeting with the focus on prevention and harm reduction. That group meets again today. But just very impressed with the number of consortium members locally who are a part of that work, supporting that work, even if they aren't recipients of the grant. A lot of buy-in from other entities in our community, the school, higher ed, and others. So glad to be a part of that work, and still feels like we're in the early stages. We talked about empty bowls. That's coming up. I'm sure if Pat were here, she would mention that. Empty
Mhm.
bowls is later this week. Yeah, that's all I have in my notes.
The bulk of it? Thank you. Very good. Anything else for the good of the order? Commissioner Hawkins, please.
Yeah, I just want to mention, Commissioner Storlie and I attended a Extension Committee meeting yesterday afternoon. That was very informative, I thought. They have a lot of services that we have access to now through the university. And we had a presentation, it was Sarah and Carrie and Mary Jo, I can never say her name right, Hartris, whatever, about what is available to us here. And there's a lot of programming that's available for family development, financial planning, mental health programming that we just need to request. And they were asking for ideas of what we want as a community and to send in our ideas. And I just thought it's a perfect lead into some of the things we talk about in this group of we have another resource that's available to us that we need to promote within this area of the county. So just wanted to share that.
It's a great reminder, thank you. I think that was one of the hopes with kind of changing the structure of things, going with U of M, so.
I'm very excited. I just
Absolutely.
really think Sarah and Carrie are doing a really good job. It's a learning process for our group,
Yeah.
totally new way of thinking about extension services in our county. And not to say that Diane wasn't good at her job, she was.
Right.
But now we've got some new people on the board and we're looking at things maybe in a slightly new way, and I'm excited about the possibilities.
Thank you for sharing that. That makes me excited, too. Anything else for the good of the order? In which case, I'd entertain a motion to adjourn.
I'll make the motion.
Thank you, Commissioner Svaleson. Is there support?
Support.
Thank you, Commissioner Sullivan. We are adjourned.
Think you'll go to the
I was so focused on driving this morning. I forgot.
and I thought you would. I would like
I
to,
do
but I
have
wasn't
my
sure if any of the other commissioners were going to.
I brought along the newsletter that
Yeah,
lists
she's got a
me as the
meeting at that
treasurer
time.
Why
because-
don't we go over there?
Yeah.
Were either of you planning on going to